Do you think perioperative medicine is part of the long-term future of anaesthesia?
I think so. Yeah, I'm on board with that.
Yes, definitely.
Definitely.
I do. It's definitely growing, and I know a lot of, as a junior level, I know it's going to be a big part of the curriculum for registrars that maybe wasn't previously, because it's growing research in that area. So there's lots to look forward to, I think, in that.
Definite yes. Absolutely. I think it's unavoidable. We've just got to embrace it.
Absolutely, yeah. I think it's an important part of what we do. I think it's quite easy to anaesthetise patients. You actually need to look after their well-being as well, which is the whole perioperative focus. So I think it's a fantastic direction.
As anaesthetists, we need to be whole body doctors, we need to be whole people doctors, and if we want to do that, then we have to embrace perioperative medicine.
Definitely.
Yeah.
Of course.
Definitely.
Yeah.
I think it's always there. It's just now got the more defined this thing to it, that it's perioperative, but I guess we've been doing this for a long time.
Definitely, yeah. It's a difficult transition, I think, because especially for the more senior members of the world, like myself. I'm quite happy with the concept, but I think it is quite difficult, and it's going to involve a lot of change, but it's definitely the way to go.
Absolutely. The perioperative management and assessment is changing everything. It is patient-focused, and the outcome is really, it is evidence-based that the outcome is far better than before this.
Potentially, yes. Yeah. It's a bit challenging with the model of care that we're offering, but yes.
Absolutely. I think we've got a really important role to play in making sure our patients have improved outcomes in the short and the long term, and I think we're, as anaesthetists, well set up to provide that service in the future.
Oh, absolutely. But I think you're talking to the converter, because I've actually did some formal education in the Master of Perioperative Medical courses. Yeah.
Yeah, for sure. I think we've got a lot of roles outside of the theatre, and getting involved in those where we can and watching our trade evolve with time.
100% yes, perioperative medicine is definitely part of the future of anaesthesia.
Yes, definitely, yes.
I have no doubt that our roles will evolve into lots of different things. Whether perioperative medicine remains as is now, hard to say, but almost certainly, we should be getting more involved in the care of patients outside of the theatre.
I hope so. I'm about to finish a master's in it in about 6 weeks. So absolutely, I think it's been another elephant in the room for so long. Yeah.
Most definitely, yeah.
I'm a big convert, and that's partly with my sort of opioid FPM hat on. I've been talking a lot during this meeting and some of the sessions I've done about how it's perioperative or preoperative management of opioids that seems to make such a big difference to patient outcomes. So I think that's an area that the perioperative medicine group need to look at, is adding preoperative management of opioids to their agenda for the perioperative medicine special interest group.
Yes, actually. I have a master in periops with Monash, so it's good to see that someone actually taking a step in that. And I think in the years to come, it would be nice that we as a body be a bit, not to say ambitious or colonize the area, but at least if we can work together and emphasize on that, that would be good. Yeah.
Anaesthesia is always going to be the core, okay? We provide an amazing anaesthetic services, and the difference between a hospital and a nursing home is the operating theatres. So that's what the engine room of a hospital is, but we're going to add value by those skills going outside the operating theatre.